Barney, and welcome to our Radiologic Technologist Lab.
Hi, I'm Erica Johnson, and I'm the Program Director for the Radiologic Technology Program here at TCL.
Hi, I'm Heather Elmquist. I'm the Clinical Coordinator.
So my job as the Program Coordinator is to help the students work through the prerequisite classes that are required for the program in order to be eligible to apply. Today you're going to learn a little information about our lab, lectures, and clinic and what to expect in the radiology program itself.
For the Radiologic Technology Program, it is a 6-semester program and it will be 80 credit hours. Looking at the salary ranges for a radiologic technologist, it's around the mid 50,000, and it depends upon advanced modalities, advanced degrees, so a lot of that plays into parts. Looking at why people get into this profession is a way to be in healthcare, look at the diagnosis aspect of injury and disease, and to provide your patients with the best quality care. And then looking at any other degrees, it does go into a bachelor's. There's also a master's in radiologic sciences, and there's plenty of advanced modalities such as CT, MRI, also nuclear medicine. And so looking at that, how you would like to advance your career, also mammography is another option. So there's many avenues in radiologic technology. What to expect during the program? We're looking at learning outcomes for the students, such as providing positioning skills, application techniques, looking at also imaging and physics. So all of that is adapted into the curriculum in providing patient care, communication, and also understanding the anatomy and physiology of the body. And then looking at our degree program, again, is 80 credit hours. It's 6 semesters between didactic, lab, and clinical. And Ms. Elmquist?
All right, so each semester consists of lectures, labs, and clinic. Most of our lectures are on campus. However, we do have some courses that are set up for online instruction. Then we have some courses that do a combination of lecture with an online component. Lab is the time that we can get our hands-on practice. We take what we learn from the lectures and able to physically apply it. As far as clinic goes, we have designated clinical sites. These include hospitals and outpatient centers. These are all within a 60-mile radius of our Beaufort campus. Each semester, a student is assigned to a different clinical site with a different rotation. Rotations could include diagnostic x-ray, ER, fluoroscopy, or in the surgical suite. Each semester also brings a new set number of clinical hours to complete. Once you graduate from the program, you will have completed a total of 1,440 clinical hours. So as far as our schedule goes, you'll spend about 4 days a week dedicated to the program. All right, Ms. Barney will speak about the application process.
So if you've been accepted to TCL, that means you also have to be able to apply to our health sciences program. It's based off the weighted admissions score sheet. So what that means is there are prerequisite classes that are required for the program, and the more prerequisite classes you have completed means the more points you earn on your application. So the more points you have on your application, the more competitive you are. We accept applications once a year, every spring for a fall start, and to mirror what was said before, it is a 6-semester program upon acceptance. We accept typically around 16 students into the program every year. You are encouraged to work on your prerequisite classes throughout the semester. So that means you can start taking prerequisites in the fall, spring, or summer, but just know that the program itself for radiology would start once a year every fall. We encourage you to look at our website for our prerequisite courses, information on the program itself, and accreditation. And any questions, you're encouraged to reach out to the program coordinator, me, Amanda, or our health sciences department. We want to thank you for watching our video and your interest in our radiologic technology program.
All right, we are going to take a chest x-ray in radiologic technology. So our student is going to place the image receptor inside of the bucky, or also we call it a cassette. And this is what the image or the x-ray will be included on when we process it. So now our student is going to place the patient in a PA projection. And this is where we place the chest against our x-ray board or our wall bucky, so we can see all the visualization for lungs, heart, and the bony thorax area. So we will place the image receptor about 1.5 inches above the relaxed shoulders. And now we're going to place our patient with their shoulders rolled against the bucky. Okay. We want to mark our patient's left side correctly. We use our identification markers to be present on the x-rays. We want to place the shield right behind the patient. And then also we're going to double check our x-ray tube to make sure we're aligned with the bucky. And as we're placing that, we want to make sure that the light field is in the box. Our patient's chin is tucked nice and high, and we want to make sure we include right at the top of the lungs and all the way down. And this is a PA projection of the chest. Okay, we are going to perform on our patient an AP projection of the ankle. We are using a 40-inch distance from our x-ray tube to our image receptor, which this is the plate that's going to show the x-ray image. Our student's going to start positioning the patient's leg so we can get a good visualization of the ankle joint. Our central ray is what is coming from the x-ray beam or the x-ray tube to enter the anatomy. So we want to make sure it's right at the ankle joint. We're going to place our patient's leg or foot dorsiflexed. And this provides a better image for the ankle joint. We want to make sure we're in the center of the cassette. And this is an AP projection. So we want to utilize with x-ray our shield and placing our shield across our patient, protecting them from ionization or radiation. And then we are going to place our right marker on the image so we know that this is the right ankle. And then after this, we would ask our patient to hold still, and then we would take our image.
I think I'm looking forward to most is applying what I've learned over the last 2 years and putting that into a professional career that I hopefully can span, until I retire and build on that.
I think the most challenging part is taking what we've learned in the classroom, the information from the book, and actually applying it to the real world, because in the hospitals and in your clinic settings, it's going to be a lot different than what you read from your book. So being able to take what you've learned and apply it to real world is probably one of the most difficult things. But you have good technologists that you work with, and you have really good teachers here that help you understand the different situations that you'll be in hospitals. So I think that was one of the most difficult things, but it's easy to get through.
My favorite thing that I've learned in the RADTECH program would be in clinic having to use problem-solving skills to adapt to patient status and get the exam done with the patient's pathology in mind.
I wasn't happy in my profession, so I decided I wanted a change, and I always was interested in health science, anything in the health field. So I decided to come back to school and I signed up for the RADTECH program. I got accepted and I'm excited about what the future holds for me. I'm excited to be back in school, you know, knowing that at the end results, I have something that's more rewarding and fulfilling for me.
I would definitely advise to try and get as many prereq classes done before you enter the program, especially the biology classes, because once you get into the program, you have a lot of clinic, lab, class, and then adding more classes on top of that is pretty stressful.